Hello, I'm Sophia, an actor and sickle cell patient. In November 2021, the all-party Parliamentary group on sickle cell and thalassemia produced a report called No One's Listening. The report found serious failings in the care of sickle cell patients across the NHS, low awareness of the disease among healthcare professionals, and even overt racism. In response, we set out to listen to patients to understand their experiences of care in the NHS. We asked them to share what a sickle cell crisis feels like, how the pain can be properly treated, and what it's like to come to A&E. Listen to your patient with sickle cell pain. Believe them. Reports have shown that patients from non-white backgrounds are consistently not listened to. Please treat patients as you would treat anyone else who comes in with pain.
You get that sense. It's never confirmed, of course, because no one's going to look at you and say you're a drug addict, right? But you can get a sort of sense over the years. You get some sort of like alarm in your head that goes off and says, they don't believe me.
So patients are expert patients. They've had this disorder for their entire lives. So it's absolutely important to listen to the patient. They're going to know a lot about their disease and a lot about how it feels to them. And if this is a straightforward, uncomplicated crisis, or is there some sort of complication, they are the ones that are most likely to flag that up to you.
But there's just some odd, like nurses or doctors who won't really treat you respectfully, or they'll talk to you in a harsh tone like you're faking your pain, or they'll try and downsize how much pain you're feeling and like try and they won't be respectful to you. Like you could be on your phone because you're trying to distract yourself from the pain, and they'll be like, then you must not be in that much pain, or like get off your phone. Yeah.
I believe people don't understand the seriousness of that illness, and especially when a child of that age is going through that difficulty. And just because someone is not dying means someone is not coming to help.
Because I've been in the hospital for like 2 hours in pain, and it ended up with me having to stay in the hospital for almost 2 weeks, when I know it could have been a shorter amount of time because of how long I was in pain for without any pain medications.
It doesn't mean that adult services are bad, because they're not, and we're dealing with a lot of complications and challenges, but it's just we as professionals stepping back a bit more and kind of trying to be in that person's position, and we know that sickle is a stigmatized condition anyway. So part of what we're trying to do as professionals, and also in my personal life, because I talk to members of the community, is to remove that stigma, see it as any other condition. Nobody questions if a cancer patient comes in and says, I'm in pain. You automatically do what you need to do, and we should be in that mindset with sickle as well.
Ensuring that you listen to the patient and the carers, keep them informed, check on them regularly, and that's my hope for the future, is that there's more awareness of sickle cell and the crisis when they present at A&E, because it is very, very awful to see a child in so much pain, and you can't handle that at home. So you're here as a last resort for help. So, help them.
People come to A&E in pain only if they can't treat their pain at home. Sickle cell pain should be considered an emergency, and since ongoing pain can cause complications for sickle cell patients, their pain should be prioritised. Patients' reports of pain must be believed. Even if they look well on the outside, it's important to remember that their pain may be excruciating. Everyone, regardless of what they look and sound like, deserve to receive the best possible care we can give. Unfortunately, past experiences in A&E have caused some patients to fear hospitals. Thank you for watching this video today. Next time you look after a sickle cell patient in A&E, I hope the interaction is enriching to you and beneficial to them.